Semaglutide, the active compound in popular diabetes and weight loss drugs like Ozempic and Wegovy, has demonstrated significant effectiveness in treating a severe form of fatty liver disease known as metabolic dysfunction, associated steatohepatitis, MASH. Results from the Phase 3 ESSENCE clinical trial, published in the New England Journal of Medicine, showed compelling outcomes across an international cohort. In the 72-week interim analysis involving nearly 800 participants across 37 countries, 62.9% of patients receiving a weekly 2.4 mg dose of semaglutide achieved resolution of MASH symptoms, like inflammation and fat accumulation, without their liver fibrosis scarring worsening, compared to just 34.3% in the placebo group. Furthermore, improvement in the stage of liver fibrosis itself, without worsening MASH, was observed in 36.8% of the semaglutide group versus 22.4% of the placebo group. A combined endpoint, achieving both MASH resolution and fibrosis improvement, was met by 32.7% of semaglutide patients compared to 16.1% receiving placebo. Participants on semaglutide also experienced significant weight loss, averaging 10.5%, reinforcing the drug's known metabolic benefits. As MASH is closely linked to obesity, type 2 diabetes, and cardiovascular issues, and currently has limited treatment options, these findings position semaglutide as a promising therapeutic approach that addresses both the liver condition and its underlying metabolic drivers. The trial is continuing for 5 years to assess longer-term outcomes. Next, news mounting evidence over several decades suggests a strong association between the common cold sore virus, herpes simplex virus type, RH1, and the development of Alzheimer's disease, AD. Professor Ruth Itzhaki and colleagues first discovered the presence of HSV1 DNA in the brains of older individuals, particularly within the regions typically affected by AD pathology, and even inside the characteristic amyloid plaques. While HSV1 infection is widespread, often acquired in childhood and remaining dormant in the nervous system for life, it doesn't lead to AD in everyone. Research indicates a critical interaction with a genetic factor. Individuals carrying the APOE4 allele, a known major risk factor for sporadic AD, have a significantly higher risk, potentially over threefold, of developing the disease if they are also infected with HSV1. The proposed mechanism posits that HSV1 reactivation in the brain, potentially triggered by factors like aging-related immune decline, stress, or other infections, leads to neuronal damage and inflammation. Repeated reactivation events over time could contribute to the cumulative damage characteristic of AD. Supporting this, laboratory studies show HSV1 infection can induce the formation of amyloid and tau proteins, key AD hallmarks, and antiviral treatments can reduce this effect. Furthermore, population studies link severe HSV1 infections with increased AD incidence, while antiviral therapy and even vaccination against the related varicella-zoster virus, shingles vaccine, appear to reduce dementia risk, bolstering the infection hypothesis for AD development. Next news, a cautionary tale from Israel, highlights the potential dangers of the painkiller Optalgin, widely used there but banned in numerous other countries, including the United States. Optalgin's active ingredient is metamizole, also known as dipyrone, an analgesic and antipyretic drug that was withdrawn from the U.S. market by the FDA in 1977 due to its association with agranulocytosis. Agranulocytosis is a rare but serious condition characterized by a severe drop in white blood cells, particularly neutrophils, leaving the patient highly susceptible to life-threatening infections. The article details the case of a young American woman in Jerusalem who developed severe agranulocytosis, neutrophil count dropped to 0, shortly after being administered Optalgin for post-C-section pain management, a standard practice in many Israeli hospitals. Despite being banned or restricted in about 30 countries due to this risk, Israel's health ministry has previously opted against banning it, citing reasons potentially related to concerns over opioid addiction alternatives. Some reports suggest that susceptibility to metamizole-induced agranulocytosis might have genetic links or be higher in individuals exposed for the first time, potentially posing a greater risk to foreigners visiting or living in regions where the drug is common. Patients are advised to be aware of medications administered, especially when abroad, and discuss alternatives like acetaminophen or ibuprofen if concerned, keeping in mind that all painkillers carry potential risks. Next news, choosing a non-toxic. Sunscreen often leads consumers towards mineral-based options, primarily utilizing zinc oxide and titanium dioxide as active ingredients. These physical sunscreens work by creating a barrier on the skin's surface to block UV rays, rather than being absorbed like chemical filters, and are generally considered safe with minimal health concerns based on current research. Dermatologists emphasize prioritizing safety and efficacy, looking for broad-spectrum protection, UVA and UVB, with an SPF of at least 30, ideally SPF 50. While the term non-toxic isn't officially regulated in cosmetics, it typically implies avoidance of certain chemical filters like oxybenzone, octinoxate, and homosalate, which have raised concerns regarding potential endocrine disruption and environmental harm, especially to coral reefs. Some also advise avoiding parabens, certain fragrances, or potentially comedogenic ingredients depending on skin type and sensitivity. Recommended mineral sunscreens, often praised by experts for sensitive skin and effectiveness, include brands like Blue Lizard, highly recommended by multiple experts for its soothing properties and effectiveness. La Roche-Posay and Thelios Mineral series, noted for gentleness especially for eczema, psoriasis. Elte MD UV AOX Elements, good for sensitive skin, contains antioxidants, tinted. Vanicream, hypoallergenic, affordable. Fora Everyday Mineral, certified organic ingredients. And Attitude, plastic-free formulation. Ultimately, the best choice depends on individual skin type and preferences, but mineral sunscreens offer a widely accepted, non-toxic approach. Next news, a recent study utilizing data from the extensive UK biobank suggests a link between dietary protein sources, fiber intake, and systemic inflammation levels in older adults. Researchers analyzed dietary information and C-reactive protein, CRP levels, a common blood marker for inflammation, from such over 128,000 participants aged 60 and above. The findings indicated that higher consumption of dietary fiber and plant-based protein from sources like legumes, nuts, seeds, tofu was inversely associated with CRP levels, meaning more of these foods correlated with lower inflammation. Conversely, higher intake of animal protein and total protein showed a positive association with CRP, suggesting higher inflammation levels. This link was particularly pronounced when high animal protein intake was combined with low dietary fiber consumption. The study stratified results based on multimorbidity, having 2 or more chronic conditions, finding the associations were generally stronger in this group. The researchers theorized that the beneficial effect of fiber and plant protein might relate to gut health. Fiber feeds beneficial gut bacteria which produce short-chain fatty acids, SCFAs, known to have anti-inflammatory effects and help maintain gut barrier integrity, potentially preventing pro-inflammatory molecules from entering circulation. While acknowledging limitations like the study population's homogeneity and reliance on self-reported data, the results support dietary recommendations emphasizing increased fiber and plant protein for managing age-related inflammation. Next news, the U.S. Department of Health and Human Services, HHS, under Secretary Robert F. Kennedy Jr., has announced a policy shift intending to require placebo-controlled trials for all new vaccines before they are licensed. This move, described by HHS as a radical departure from past practices, aimed at providing straightforward public health information and ensuring transparency, has drawn sharp criticism from many public health experts and medical professionals. Critics argue that while placebo-controlled trials are standard for entirely novel vaccines, mandating them for updates or modifications to existing, well-established vaccines, like seasonal COVID-19 or potentially flu shots, is ethically dubious, as it would intentionally withhold known protection from a control group. They also warn this policy could significantly delay the availability of updated vaccines needed to combat evolving virus strains, potentially putting vulnerable populations at risk, and could paradoxically undermine public confidence in vaccines. HHS contends that even childhood vaccines, except COVID, lacked inert placebo testing, a claim disputed by experts, who note many were initially tested against placebos. The exact scope of which vaccines HHS considers new and subject to this requirement remains unclear, though statements suggest significant updates to existing vaccines might qualify.